Good evening, everybody, and thank you so much for joining us for tonight's Cafe Sci. My name is Sarah Grumman, and I'm honored to be your host for the evening. Cafe Sci is presented by PPG. It is also supported by wonderful folks like yourself. Thank you to everyone who's donated to support this program. If you're unable to donate, but would still like to support Cafe Sci, the most helpful thing you can do is invite your friends to join us in the audience. Cafe Sci typically takes place the first Monday of each month, and you can register for next month's speaker at carnegiesciencecenter.org. Before I introduce our lecturer this evening, I'd like to remind you all that there will be a Q&A after the talk. For our on-site audiences, as always, please raise your hand, and our wonderful Drew over there will bring a microphone to you. Please wait until the microphone has come to you and then speak into it so everyone can hear. Online audiences, you can ask your questions by using the Q&A button at the bottom of your Zoom. You can enter your questions at any time during the presentation, but we will hold all questions till the end. It's my pleasure to introduce tonight's speaker, Dr. Andrew Nowalk. Dr. Nowalk is an associate professor of pediatrics and interim division director in the Division of Infectious Diseases in the Department of Pediatrics at UPMC Children's Hospital of Pittsburgh and the University of Pittsburgh School of Medicine. A native of the Greensburg, PA area, he graduated from Georgetown University with a bachelor's degree in chemistry before enrolling at Pitt in the combined M.D. Ph.D. program, where he conducted research in microbiology and biochemistry. Dr. Nowalk joined the faculty at the School of Medicine in 2005. He maintains a clinical practice and an active research program in Lyme disease and healthcare-associated infections, and frequently teaches students, nurses, and residents about combating vaccine hesitancy. A published author of more than 60 papers in medical journals, Dr. Nowalk is the director for the pediatric residency program at Children's Hospital and serves as the vice chair for international relations. His passions include promoting vaccines and visiting the Carnegie Museums with his wife and 3 children. Thanks for that shout out. Let's give Dr. Nowalk a big hand.
Thank you. Thank you, Sarah, and thanks for, first of all, thank you so much to the Science Center for the invitation. It's a distinct pleasure for me. We really feel honored to be able to speak to you tonight, especially about a topic that is not only near and dear to my heart as a pediatrician and as an infectious disease specialist, but is very much in the news these days. So we're going to talk about measles, and then we're going to talk about measles twin threat, which is really misinformation. They're both viral, but I think of misinformation as the bigger threat in a lot of ways. So my disclosures are very straightforward tonight. I have no financial or other conflicts to disclose related to this lecture. If you want to give me money, I'm open to it, but I don't have any conflicts of interest. In terms of misinformation, if you go on Twitter, which I guess some people call X, or Instagram, I am making gobs of money off of vaccines, which is interesting because that has just not gotten to me in the mail yet. So I have cared for many children as part of my job as an infectious disease specialist who are injured or dead from vaccine preventable diseases. If you are someone who's upset by the words dead children, I'm going to mention them a lot tonight because that's what measles produces, and that's what these vaccines or preventable diseases produce. I read all the time online that these are harmless, and I wish I could take the parents who I've counseled in the rooms at Children's Hospital over to those people who posted that and show them the grief that they feel. And then finally, sadly, I have to declare this as a disclosure these days. I believe in the power of vaccines. Misinformation says they don't work, but I'm going to show you a lot of data tonight that I hope you'll remember. And the next person who says, oh, this is harmless and those vaccines don't work, you'll have a little bit of something in your toolbox to help them out. So why are we here? This is the picture. This is a graph, and you can see that the x-axis is our dates going through 2023 to now in 2025. And you can see the very distinct difference in 2025 in measles rates. And there's a couple of things I want you to appreciate about 2025. Number one is that we've had week after week after week after week after week, which is larger than any other point on this graph, right? But the second thing is the sustained nature of those bars on the right. They are not going up and going down as you see in some other years. They are up and they are staying up. We have a problem. This is a headline from the Wall Street Journal. U.S. eliminated measles in 2000. The Texas outbreak could upend that. I would scratch out could and said has upended that. And then finally, this is very unusual for us this early in a measles outbreak to see children die. We've had 3 children die in this outbreak already. We've had 4 total deaths in the United States. This is a major public health concern and has all of us worried. So what is one of the big problems here? One of the other big problems along with the measles outbreak is misinformation. We have organized groups who are really set against me to try to convince people that vaccines are dangerous, are bad, are ineffective, are poisonous. We have organizations like this one, Child Health Defense, inappropriately named, that produce these very news-looking videos where they interview parents, 2 parents of one of the children who died in Texas, and got them on camera saying that they still think measles vaccine is poisonous. Just heartbreaking. And then finally, my favorite one, this is recently. First of all, very repetitive. I really don't think that he's really doing a good job of making his point, but this is everywhere. And so the misinformation is everywhere, and it's insidious. And so I'm fighting not only the measles, but I'm fighting this. So that really leads me to just 3 things I'd like to do with you today. The first is history. All infectious disease doctors are history buffs at heart, because we really want to learn from the history. So why are we so afraid of measles, and where did it go? Because we haven't had it for a while. I am briefly going to talk about the scope of the outbreak we have now, and I'm going to talk about where it may go. And then finally, I'd like you to leave tonight with a few simple tools of things that I think through when I want to counsel someone. And I'm not talking about the poster who says pediatricians are a scum. I'm talking about, someone you run into in the store who says, oh, those vaccines don't work. Just a couple of small tools you can use to respond to that effectively. And I'm going to, unlike the misinformation on the web, give you references for all of these data as you go, so you can see everything that I'm talking about. And every reference I have is in the public domain. So if you don't believe me, you can look it up. So as I said, we'll start with history. This is clearly a very old book. And this book was called Of the Fatal and Mild Species of Smallpox and Measles. These are old diseases. So this was written, more than 1,000 years ago. It's actually the first definitive work on measles that was ever published. And because of the Wellcome Collection, I can show you this page. I love the old medical books because they say the safest kind of measles is where the redness is not very deep, but the pale or tawny colored are bad, and the green and violet colored are mortal. And then finally, when the measles sinks in suddenly and the patient is seized with anxiety and a swooning comes on, although in present day, I'm often seized with anxiety and a swooning comes on when I just watch the news. So this is not as accurate today, but it is a sign of a speedy death. So the very first report about measles described how lethal this infection was. And I'd say we're number one because I'm a Pittsburgher and I think of us always as number one. But in infectious disease, we have a weird habit for the last 150 years or so of naming the rashes that are associated with infections. And first disease, you may have heard of fifth disease if you have kids, fifth disease. First disease is measles. And why was measles first? If you look up this reference, which is from 1900, not my oldest reference, but a good one, first disease is there because measles was always known to be the most lethal of these infections that were seen in children. It came first because it killed the most. And more bad stuff. Measles is bad. I've already made that point, but I'm just going to really beat this horse. So just when you think about the devastation of the New World after Columbus came, tens of millions of people were affected by smallpox, and then tens of millions more were killed by measles. And measles was actually thought to be more devastating to the Incas in South America than smallpox had been when we think about Central America. And then finally, something I learned prepping for this lecture, that the first major measles outbreak in Japan was in 1862. And this was the Japanese saying that arose from it. Hoso, smallpox, determines one's looks, but Hasika, measles, determines one's life. This is a really severe infection. So why aren't people frightened of this? I'm giving you thousands of years of text to say why we should be frightened. I'm going to demonstrate why in a very technologically advanced way. We're going to use a rigorous scientific poll where I'm going to ask you to do something where you take your hand out and you raise it in response to the question. So raise your hand if you had measles. So we have a more experienced audience here. We have a number of folks with measles. I will observe, I'm a scientist, a correlation between experience and measles in this room, which is very common. Raise your hand if you know anyone who ever had measles. Keep them up there. Okay, keep them up there. And then keep them up only now if that happened in the last 25 years, that you knew someone with measles or you had measles. We have a couple hands up. I'll raise mine. Those two patients were in 2009 in the Children's Hospital Emergency Department. So there are some, and unfortunately, more hands are going to be raised as we move on. And more on why we had that gap later. That's a secret. Actually begins with a V, and it rhymes with vaccines. So why else is measles bad? It's a lethal disease, but it's also remarkably transmissible. So when people have measles and they just breathe out, they don't need to cough. They breathe out aerosol droplets that hang in the air for 2 to 3 hours, and they are breathable by anybody who comes after. So when I'm seeing a patient with measles, I look like this. Those masks are very uncomfortable, but they're necessary. And the eyewear is necessary because it can even infect you through your eyeballs. It's a nasty infection. And the peak infectivity, this is what makes me the most worried about where we're at now. The peak of infectivity happens before you see the rash. Because you might think, oh, well, when I get the rash, I'll know to stay away from people. You may even have virus being shed from your upper respiratory tree before you have any symptoms whatsoever. And I love this chart to talk about how infectious measles is. This is a chart which is one of the nerdiest of all concepts for us, the R naught. I see some people smiling. You may have heard this before. So the R naught is a really easy one. I have this infection. How many people would I typically pass it to? So let us say I had Ebola. I do not. Who could I pass it to? These two people. That's an R naught of 2. Let's say I had SARS. I do not, but I might get you two and then both of you as well. And then what about mumps? Mumps is very infectious. COVID a little bit more. The latest COVID strains are about an R naught of 12. But the grand champion, the undefeated legend of transmissibility is measles, which has an R naught of 18. If you drop a measles patient in a house full of susceptible people, typically 95% of those people will become infected with measles. Remarkably transmissible. So it's also a disease that makes people really sick. This is the nerdy doctor stuff here. You have a long incubation period. That's not so bad. You have viral shedding before you have a rash or symptom. That is bad because you can shed to lots of folks. And it starts out as a pretty regular URI. You have cough, you have what we call coryza in medical school. I was taught, but it's just a runny nose and conjunctivitis. But what really begins to tip you off is your fever is high and relentless. And then that rash begins here and it spreads down the body, and it is impressive. So this is the measles rash. It has its own Latin name, morbilliform. So morbili is the name of the rash. And what you can see about this rash is the intensity of it. It is fire engine red when you see it. It is coalescing, they come together, and it's intensely all over the body. And one of the things I remember from the cases I've seen is that measles makes children sick. When you look at this picture, you don't need to be a pediatrician. You immediately begin to get a little nervous for these kids because they look terrible. I mean, they look actively ill. And I give you some variation on skin tones here to show you the rash on different skin tones. But the commonality of all of these children is just how ill they look. So children with measles are really, really sick. 1 out of 4 of them will end up in the hospital. 1 out of 1,000 of them will have inflammation in their brain. Many of those will die, but then there will also be deaths, even in resource-rich populations, from measles, from pneumonia, and other sources. So this is a very, very serious infection. And its pattern of illness, just to show you quickly, is very distinctive in what's allowing us to pick it up. I will say that cough and coryza, we call them conjunctivitis coryza. We'll call them pink eye and runny nose. This is dime a dozen. In the middle of winter, if you say this is specific for measles, 3/4 of children in Pittsburgh have measles because it's so common. But when you get to the fever, it's very high, and that distinguishes, and the rash is very easy to distinguish from other infections. This is a really serious one. And I can't emphasize enough, why do I keep coming back to you're contagious before you have any symptoms? Simply because you could spread it to lots of susceptible people, which I'll get to later. So what does this do? It kills. Complications are much more common in malnourished children and adults. And worldwide in 2000, when I was a wee little intern at Children's Hospital, we had 600,000 deaths in the world in 2000. We've gotten that down to about 135,000 deaths in 2022. Guess what happened in between? It begins with a V and it rhymes with vaccine. So it causes all sorts of stuff, ear infections, it can cause eye damage and blindness, but it kills. So diarrhea and dehydration in vulnerable populations without access to care, pneumonia and encephalitis in everyone, regardless of the best care that you have. The children who died in Texas got care. They died anyways, because this is a lethal infection. So I always return to this story because it breaks my heart every time I read it. Roald Dahl, you may have been wondering, what the heck does the BFG have to do with pneumonia here? This leads me into Roald Dahl. Roald Dahl, one of my favorite authors as a kid, you know, Charlie and the Chocolate Factory, James and the Giant Peach, the BFG. Roald Dahl wrote this about his daughter. Olivia, my eldest daughter, caught measles when she was 7 years old. After the illness took its usual course, I can remember reading to her often in bed and not feeling particularly alarmed about it. Then one morning, when she was well on the road to recovery, I was sitting on her bed, showing her how to fashion little animals out of colored pipe cleaners. And when it came to her turn to make one herself, I noticed that her fingers and her mind were not working together, and she couldn't do anything. "Are you feeling all right?" I asked her. "Feel all sleepy," she said. In an hour, she was unconscious. In 12 hours, she was dead. So this is what measles does. And the encephalitis is the most severe manifestation, but children die quickly from it because of its severity. So that's all about measles. That's what its history was. And I wanted to give you a sense of it. But why are we having this outbreak? Well, first of all, to return to the outbreak, to return to our regularly scheduled programming, we had this graph at the beginning, which shows you our outbreak now. I want to highlight that this outbreak started in Texas, but I also want to highlight the number of states now that are reporting outbreaks. And the problem is, these are not all driven by Texas cases. The first 2 cases in Pennsylvania were from people who are traveling internationally. We're also seeing a lot of measles cases internationally as well. But to give you perspective, I showed you 2025 and 2023. I just want to show you very clearly 2025 in the last 25 years. You can see here that the outbreak this year in 2025 is really the biggest one in the last 25 years. And we're only 3 months in, or 4 months in at this point. So we're clearly going to exceed there. But to give you a sense of how bad things could be in previous years, this is where we are now. And this is when we take that map back to the 1990s and 1980s, when you can see the last major measles outbreak, when we had the 1-dose vaccine series, and we had 30,000 cases in the 90s. You'll never guess what happened here. Begins with a V, rhymes with vaccine. But to give you a sense of what vaccine has done to save children's lives, this is what measles looked like before then. So remember that big bump in 2020 and 2019? You can't even see that. The 1990 bump, which was all the way at the top of the screen, is now down here. This is what it used to look like. Hundreds of thousands of cases a year. And in fact, it was ubiquitous. By the age of 5, everyone had measles in the United States. So everyone got infected along the way. This tells you why it killed so many people. And you can also see here with licensure of vaccine, how it really began to control, and then with the second dose, completely eliminate measles for the most part from the United States. So why are we back then? So, I mean, it said it right there, measles is eliminated. Why am I giving you this lecture? So sadly, this is why I'm giving you this lecture. Thank you to the CDC for providing me this great data. This is 2009, kindergartners in the United States by state. And so we're looking for blue. I put a red box up around that because 95% is the key barrier. If you're above 95%, you're never going to see measles in your community. If you're below, you have a chance that you will. You can see here that about half of states were above 95%. Pennsylvania, not doing so well, unfortunately, because a lot of our Amish and religious communities don't vaccinate at all. Keep an eye on the blues. And then let's move to 2024. So that is depressing. That is really depressing. And this is the hard work of anti-vaccine groups across the United States. So we have really crippled effective coverage in the United States. And you can see the vast number of states in the United States that have really, really reduced their coverage. And I'll highlight a couple for you that you may think would be unusual for me to highlight. I'm going to highlight Mississippi, West Virginia, and California. I'm a native Pittsburgher. I have made so many West Virginia jokes in my lifetime because it's state law, I always figured. But West Virginia can make a lot of jokes around us because West Virginia does not allow exemptions. You'll never guess what Mississippi, which we make fun of a little bit too, does not allow exemptions. And California, due to an old Pitt medical student, my friend Richard Pan, and his bill in the mid-2000s, California does not allow exemptions. Very strong correlation on this map with good coverage and not allowing religious and philosophical exemptions. But this tells you we are in trouble because of this, and this also guarantees this outbreak is probably not going to go away. So let's just look at the data just to show you this is a disease that hits kids. These are our total cases as of last Friday. If you look at them, the youngest are hit hard. So under 5-year-olds are only about 7% of the US population. They're 30% of cases. When you look at this outbreak, it is almost exclusively, staggeringly, an outbreak of the unvaccinated child. Depressing, but predictable. When we look at hospitalizations, the hospitalization rate has been pretty okay, 13%. But then again, look at those kids, 25%, a quarter of them are going to get hospitalized, just as that earlier slide showed you. And then sadly, 3 deaths so far this year. In the news, certain public health officials have said, we see measles deaths every year. That's wrong. That's a lie. We do not see measles deaths every year. The 3 deaths this year, there are 4 actually, but New Mexico refuses to report their death. The 4 are greater than the total from 2015 to 2024. So we don't see measles deaths every year. This is a new phenomenon because we're allowing these kids to die. Every measles death is a preventable death. So what's to come? This and $3.50 will get you a cup of coffee at Starbucks. But I'm going to tell you that there are some things we can predict. There are so many unvaccinated states up here that we're going to have enough to really keep this outbreak going. I think it's going to continue to smolder through summer and fall, especially in summer. Kids get together a lot in the summertime. They go to camps, they travel around the US. That'll help move cases around. And I'm fairly confident that we're going to get to the largest outbreak since 1990, which was 30,000 some cases. We're not going to get to 30,000 some cases because we still have a high enough vaccination rate in most areas to prevent that. But I'm starting to get nervous that our vaccination rates are falling enough that this is going to become endemic. Okay, so we talked about history, we talked about the outbreak, and I want to talk about tools. I want you to leave here with something other than what a smashing set of animations he's had tonight. This is great. So the first tool, and really, if you forget everything, you forget my witticisms, you forget the smashing animations, you forget all the data from the CDC, if you can just remember this, then I've done my job tonight. The single best tool to prevent measles in anyone prior to exposure is vaccination, period. It is an absolutely devastatingly good tool. And in fact, if you've not been vaccinated, which given this crowd, probably you all have, but if you've not been vaccinated, the best way to prevent measles is actually still vaccine. It's effective within 3 days of exposure, and it's really, really good at preventing any development of measles. So just remember those. But I'm going to give you a few more tools as well. So the next things that we have, I just want to highlight. What do we have besides vaccine? Not much. We have mostly thoughts and prayers. Immune globulin we use sometimes in those who are really, really immune compromised, but we can only use that up to 6 days post-exposure. And immune globulin, you have a lot of breakthrough with immune globulins. How about vitamin A? You've probably been reading a lot about vitamin A in the news. It is absolutely true that in resource-limited settings and malnourished children who are malnourished globally, you're going to find that vitamin A is actually going to help their outcomes. But there's no general treatment on people who are well-nourished. And if you go to the CDC website, which recommends using vitamin A, it says, we don't know if it's going to make any difference whatsoever. So vitamin A will absolutely not save you from measles. And then I'm not even going to address ivermectin. But I will mention that antivirals, we're in a golden age of antivirals for COVID, for influenza, for HIV, for hepatitis C. We have nothing for measles. We just have not been able to come up with something. So measles vaccine as a part of MMR is the best way to prevent this. It is safe. It is a very safe vaccine. Do people have reactions to it? They do. They are local, they are limited, and they are non-severe. Some people will get a little bit of fever, and even in about 5% of children get a very, very mild rash, a handful of spots, 10 to 14 days after the vaccine. That is not a severe reaction. That is only building immunity. As I said, effective, 97% effective, tremendous rate. And it's prevention as well, post-exposure prophylaxis, which is amazing. So this vaccine works. But now I'm going to go to the question I get more than anything else when I'm talking to parents or folks in the community, but what about autism? You know, this has been around for a while. It springs from this paper. And you can see how the Lancet feels about their paper, because if you go to the website and try to download this paper, that's what it looks like. They actually have a big red retracted on it. So this is one study in 1998 by Andrew Wakefield. It was 12 children total. No control, no placebo, no nothing. And as it turns out, what he did was fake the data. He falsified the pathology results in 2/3 of these kids. He falsified the timing of the vaccine and the development of autism in 3 of the children. And then he falsified their prior developmental history in 5 of the children. There was not a single patient in his study who he did not falsify some data on. And a significant number of the parents of these kids have come forward to say that what's reported in the paper is actually untrue about their child. And since then, because he created this, we have done amazing work. We are now at about 1.8 million children who have been studied in cohort studies and several thousand children who've been studied in case control studies. There is no linkage between autism and MMR. And I'm going to be happy to be open and honest. My wife has given me permission to share. I have an autistic child. I have my 3rd child is 19 and he has significant autism. So I'm very invested in why children have autism and how we can prevent it. I put a lot of my energy into that as well. And I will say, we need more autism research. My God, we do. We really, really, really do. But there's one thing I know we shouldn't be putting our money into, and that's looking at MMR again. We need to take those hundreds of millions of dollars and put them into early intervention and a better look at toxins in the environment that may be associated with it, because MMR is not what's causing it. Okay, vaccine, we've talked about the autism thing, we've talked about, but how do we engage? Because part of this is I'd like you to come out of here feeling a little more confident about your neighbor, your aunt, your nephew, whoever you're running into, the barista selling you the $3.50 coffee. I want to talk about some simple tools around engagement, common ground, and then using data. First of all, engagement. I welcome these conversations. And I think this is something that we as physicians might not have done as well. Sometimes I think we've pushed away. You see some practices exclude vaccine refusing parents. I really welcome these conversations. I welcome them into my office, in part because as an ID doctor, it's what I should be doing, but in part because I want to reach out to them. And I will always find their concerns. I'm always open to their concerns. I want to know what they think. I'm really interested in where they got the information from, because that's a key part of what I do. And we always have common ground. You will have common ground with every anti-vaccine person in your life, because you both are really interested in children being healthy. And so I will always say to these parents, no matter how diametrically opposed they are, and sometimes I'm talking with parents who are so diametrically opposed from me, I find it remarkable that we're having a conversation. But I always start with the fact that we share a really common thing. We share the common thing that I want their child to be healthy and they want their child to be healthy. So we're coming from the same place. And so I really continue to have respect for that in every encounter. And I think in a day where dialogue is really encouraged to be as loud and as obnoxious as possible, that's a really key point for us to have. And I always bring data last because people are, I think, always a little bit triggered by data. But the data, I just say, this is where I got it from, not just the CDC, which incredibly has a bad rep with some people, but for some reason, when I say State Department of Health, no one has a problem with them. And they're great people. I know, it's odd. I can't figure that one out. And they're PCP for the most part. I highlight what we know is true. I do say measles kills kids. I just say it over and over again. I really am trying to destroy for them this myth that measles is a harmless virus. And then I always talk about autism, because if you don't talk about the elephant in the room, that elephant will trample you every time. You have to bring up autism with them. And then I bring them to people that I think they want to protect. And I use examples like, who do we really need to protect? We really need to protect a 3-year-old in our community with leukemia because they can't choose to be vaccinated. We really want to protect a 40-year-old in our community newly diagnosed with rheumatoid arthritis and on terrible steroids or rituximab. Their vaccine immunity may have waned because of that. They can't protect themselves. Or a 60-year-old who's getting a bone marrow transplant for breast cancer. They can't choose to be vaccinated. We are Pittsburgh strong because we care for our community. And I think about this as caring for our community. People with immune conditions or very young children without vaccine can die from this infection. And in fact, if you go back the last 25 years, most of the time, the folks in the community who are dying from this, the first ones to die are those who are immune compromised. So they really depend on our community to protect them and vaccinate. And that's the last thing I tell folks. I'm like, our community is depending on us to protect them. Those people with cancer, those people with bone marrow transplants, those premature infants, they're depending on us because they can't choose to protect themselves. So it's our obligation to be good members of our community. I will stop and say, sometimes not even that works because anti-vaccine misinformation is very effective. But a lot of folks recognize that they have a commitment to the community and are at least willing to discuss with me. But boy, I'm going to end with misinformation because, wow. I just put this up here because it's one of my early favorite posts. It's a Facebook post. Bill Gates explains that the COVID vaccine will use experimental technology and permanently alter your DNA. It's not what he said if you listen to any of that, but this is everywhere. And so there's a couple of really good things from Statista, which is a website I love, and the Kaiser Foundation about widespread belief in measles misinformation, and then parents hearing these claims all the time. And unfortunately, relatively few of them believing them. But I just want to point out, the reason this is everywhere is not because you have a lot of earnest people posting what they think. This is engineered and funded by very few groups who are looking to sell things as a result of vaccine refusal. So this is from Leanna Wen's amazing work, which she's been doing for a decade in the Washington Post. Majority of anti-vaccine ads on Facebook funded by 2 groups, still roughly the same today. Their tax records, the people who run these groups are making millions of dollars off of this. They're breaking in millions of dollars, and they're often connecting it to natural products that they sell that are better than vaccine. And I'm going to highlight the Children's Health Defense because the Children's Health Defense is one of the biggest funders of this misinformation. They are the sponsor of that video in Texas where they took a news crew to parents of the child who died from measles and then got them to talk on camera about how measles vaccine was still bad. The level of shame that these people should feel would be amazing if they had any shame whatsoever. So misinformation, the first thing I want you to do is just identify it. How can you tell? Because some of this stuff looks slick. There are almost always warning signs. Pasted screenshots always scream in misinformation to me. And you'll notice I have these funny things called references under here. that you could click on and you could go to. You will almost never see links to source data or site. And almost always information is designed to inflame. It's not designed to inform. So here's one from my Facebook feed. So this is a Facebook post I saw clearly on April 23rd. And this Facebook post said, 1970 to 2020, 1,300 athletes suffered from cardiac arrest and died. In 1 year, 2021 to 2022, 1,598 athletes died. I'm like, wow, that looks like total BS. Because it had all the ARMA. There's no links to data there. There's no studies cited. There's dramatic numbers. Cardiac arrest and died. And then 1 year post-COVID vaccine that happened. So I put my money where my mouth is, as I typically do, and I put this up here. And I'm going to use this just to highlight, how do you fight back? This is just one philosophy for doing it. Cite sources. I almost will put a news clipper in there. Honestly, Washington Post, New York Times, Wall Street Journal. I often will stick a Wall Street Journal in if it's one of my more conservative friends, because they are putting out fairly accurate stuff about the measles pandemic. I use strong but respectful language. I said here, this is not true. The meme is made up. And if this was about measles, I'm going to talk about dead children. I actually had one of my friends say, you know, you're so overbearing about the dead children. I'm like, just listen to the statement that you made to me. I'm overbearing about dead children. I'm always going to be overbearing about dead children because no one should be in favor of dead children. It should be one of those things we can all agree on. And then finally, continue to engage the misinformation and where possible, respect the person. The thumbs up sign on there was from my Facebook friend who posted this, who then sent me a private message and said, I didn't know that was true. And I skimmed that paper. Yeah, I don't know why that guy put that up there. One person at a time, one post at a time, one opportunity at a time is how we do this. I try to respect the person because everything on social media is encouraging us to be angry at each other. But when we build bridges, those things are going to work more effectively. All right, I think I'm doing okay here. Yeah, 7:40, beautiful. So final thoughts. Why is measles with us? It's with us because of malicious people who encourage vaccine refusal and hesitancy. We are not that far, though, from getting back to good community immunity. We don't have states at a 50% vaccination rate. So good vaccination is within our grasp. And this effort really has to come from all of us. We need to fight the misinformation. We need to be respectful, data-driven, and engaged. And we really need to take these opportunities to protect our community in this way. That's all I have. I'm happy to take some questions.
Okay, quick reminder, folks, we're going to open the floor to questions. I've already got some really excited questions from our online audience waiting. This is Drew for our on-site folks. If you've got a question, put your hand up. Drew will bring you the microphone. Please wait until it is in your hand and then speak into it. Thank you. Okay, let's start with this gentleman up here.
My question is, if you've had measles, can you get it a second time?
So what we know, which is a fantastic question, and for the online folks, if you get measles, can you get it again? Most of the time, no. So when you get measles, it gives you very durable protection, as does the vaccine. However, in our modern medical world, we now have developed a remarkable number of medicines that can take away that immunity. So when I care for a children's hospital, we are the home of liver transplantation in children. First liver transplant ever done in a child, done in Pittsburgh. We've done more than any hospital in history in children. Those children lose a lot of their baseline immunity and become much more susceptible to things they were vaccinated against. Or if they had had natural measles, they would be susceptible to that. So if you have had natural or wild type measles, you're in really good shape. But when you get other medicines that can decrease your immunity, that can put you back into a risk category. And that's why you need community immunity to protect you.
Okay, I'm going to go ahead and throw out one from
Sure.
our online audience. This came in early, so this questioner may not have seen some of the links on the bottom of your slides, but Marianne asks if the references that you provided, that you used, can be provided or sent to attendees of this lecture. So
I'm happy to put them in a file and send them out. I'll actually just send you the slides and you can use the references.
that sounds great. Thank you.
Yeah, I have a question, really kind of a follow-up question. So
Sure.
we always hear of measles as this disease of children. What about like the elderly? Is it that they have baseline immunity from exposure earlier? What is it that makes it a child-oriented disease?
So what an interesting question, and what a great question about how that immunity wanes over time. And this is going to change in the next 20 to 30 years as we lose our cohort of people who saw wild type measles, and we have mostly people who are vaccinated. This is actually a very big interest of the infectious disease community. Children are remarkably vulnerable to everything. The impact of routine vaccination, this is a paper a couple of years ago in The Lancet, has been estimated since the 1970s to have saved 150 million lives worldwide. Of those, 143 of them are estimated to be under the age of 5. Children under the age of 5, as they build their immune systems and build their immunity, they build it, they don't go like this where they suddenly are immune, they build it slowly. And so, children under the age of 1 in particular, just stroll the Allegheny Cemetery. It's right next to Children's, and you may think it weird, but it's a really nice walk in the middle of the day at Children's. There are an enormous number of graves for children where their birth date was 1850 and their death was 1851 because of that exquisite susceptibility. What I'm worried about is that as we have only vaccine-derived immunity, we're going to start to see some ability for older adults to get infected. We haven't seen it yet, but there are a number of adult cases in this recent outbreak, and even vaccinated adults can get a very, very modified form of it if they've only had 1 dose. So it's an interesting question. Kids are really susceptible, though. Immunologically, they're a disaster area, and so we see them get very, very severe infections along the way. Great question.
We have a very much related question from
Okay.
an online audience member. So Ramona asks, what can you tell us about the value of grandparents getting a vaccine?
The value of grandparents getting the vaccine, most grandparents are not going to need it because they probably had wild type or they've been vaccinated. But what does a child depend on grandparents to do? Keep them safe. How do you keep a child safe if you're not properly vaccinated? Get vaccinated. I'm going to bring up another childhood disease, whooping cough. People say whooping cough. I mean, there's no big statistics on whooping cough. In my career at Children's Hospital, I've taken care of 5 infants who died of whooping cough. Pertussis is a lethal disease in a neonate. And so if you're a grandparent in the audience, your grandchild needs you to protect them. And whether that's whooping cough, measles, or influenza, or COVID, all of those things can keep your grandchild safe. So most of you won't need it. I get this question a lot. Most of you will not need it if you've had wild type or adequate vaccination. But if you're worried or concerned, you can always just have your PCP check your measles antibodies. One of my brothers did that recently. He had only had 1 vaccine dose in the 1970s. He had his antibodies checked. He had really great measles antibodies still. So he's protected, so he's okay. But you can check that out if you want to measure it along the way. If you're a healthcare worker, you need to know 100%. And so at Children's, if you don't have documentation of 2 doses, we really, really want to get your antibodies. And even then, we often will default to asking that person to get their antibodies checked because we want to make sure our hospital is the most protected place for a child to come into.
All right, we've got a lot of questions here coming in from our online audience. So kind of similarly, one of our attendees online has asked, as a healthy older adult who was vaccinated in the 1960s, am I still protected against measles given more recent vaccination protocols? If not, what do I need to do to fully protect myself?
So this will lead me into a quick description of the fact that online you will hear one of the craziest things lately is vaccines are never tested against placebos. Yes, they are. They all are. I don't know where that comes from. That some health officials have been chanting that. You know, these haven't been placebo tested. They're all placebo tested. You know, even polio vaccine back in the 50s had a placebo trial before it went to mass vaccination. We always tested them against placebos. I don't know where these guys come from. So I will say, certainly, as we're thinking about vaccination, that our vaccines get better over time. And one of the things about measles was the first measles vaccine that we had was a killed viral vaccine. And as it turned out, it was okay, it wasn't great. And then Maurice Hilleman and company, Maurice Hilleman, nobody knows who he is. He invented 20 different childhood vaccines, and he's a hero of mine. Maurice Hilleman invented the MMR vaccine and those strains. So if you were vaccinated in the 60s, actually, you have a fair chance your vaccine was not that effective. So if you got a dose in the 60s, get another dose would be I wouldn't even get your antibodies checked. I'd just get another dose along the way, or you can get your antibodies checked. But I just say, when in doubt, get a dose. You know, it may produce immunity if you didn't have it, and it'll boost immunity really, really well. I've actually had 4 doses because of remarkably poor record keeping in my past. And every time I get my titers checked at Children's every 10 years, they're like, wow, you have a lot of measles antibody. I'm like, yes, I do.
And so just to follow up with that, you said if you were vaccinated in the 1960s, you may not have had a very effective.
You may not have had an effective vaccine. You should just get another dose of vaccine.
So because we have another question online from someone who said that they were vaccinated in the late 70s and asked if they should be vaccinated again.
Probably not.
Okay.
Although, you don't need much from me to recommend another dose of vaccine. Yeah, I'm easy that way.
So it sounds like from what you're saying, and I'm fielding a bunch of similar questions.
Yep.
My mother is also texting me. Actually, to be fair, I texted her first.
First time caller, long time listener.
I texted her first to be like,
okay,
when were you vaccinated or did you get sick?
Okay.
So if you were to make a broad generalization for folks who were maybe vaccinated before, what year might they be best served to get another vaccination?
Anybody vaccinated before 70 who didn't have measles itself should get vaccinated.
Before 1970.
Anybody after 1970, when the vaccine was much better, should have had 2 doses. So if you remember back to the slide, remember that slide in 1990 where we had 30,000 cases? So we initially had a really big decrease in measles. And what we realized was when we gave that first dose to the 1-year-olds, we actually created not the best immunity. And so we had breakthrough. Once we gave the second dose, which we give to kids around the age of 4, it wiped it out. So, if you've had one is good, 2 is better.
So I'm very intrigued. When we think of COVID, we think of it evolving all the time.
Oh,
the
yeah.
COVID vaccine is always changing. It doesn't sound like measles does that.
It does not. What a great question. But I have lots of friends who are virologists. I'm going to be open and honest with you. I'm a bacteriologist and the really
And a chemist.
You're a dentist?
Chemist.
Chemist. Oh, chemistry was my degree at Georgetown. So all good bacteriologists come from chemistry. So I make fun of the virologists, but what the virologists tell me is if you've seen one virus, you've seen one virus. So we have some of these viruses that COVID is unbelievable. It looks a lot like influenza, which is the grand champion of mutations. But measles is fairly stable in terms of the key pieces. Measles can have a little bit of genetic variation, but what it doesn't vary are the things that the antibodies are directed against, the proteins on the outer surface of the virus. So while it can undergo some mutation, it really hasn't. Could it at some point mutate? As someone who loves science fiction, yeah, 100%, because it becomes science fact. Measles comes from an older virus that's been around for probably 10 to 15,000 years called rinderpest, if you really want to get nerdy. And rinderpest was more of a disease of domestic animals. And then rinderpest made the leap into humans and got modified into measles, which is really the story of a lot of major disease outbreaks, making a leap out of an animal into a human, and then bad things happen like I'm a mouse in 1453 coming off a ship in Genoa, Italy. A bacteria makes a mutation and we get bubonic plague or, the influenza outbreaks. So it could, but we haven't seen it really at all as a significant issue in the last 100 years of measles. Knock wood, because if there's something I never want to see, it's a uncontrolled measles outbreak with a new strain. That would be terrifying because of its transmissibility. Its transmissibility is just staggering in every way, shape, or form.
Okay, let's see here. Mic on? Yep. Okay, one of our attendees online has asked, what is the difference between measles and German measles? And I'm sure it's not just the accent.
Right. So German measles and measles, so German roseola, rubella and measles are the two. Measles is measles and then rubella is German measles. They actually look a little bit the same. They have a little bit of similarity in they both start on the head and move down. But rubella is benign. You have a very, very mild rash. It's described as a really pinkish, salmon pink colored rash. You don't have the coalescent rash that you have with measles, and you get over it really, really quickly. Now, is rubella good? No, it causes a really high rate of birth defects, which measles does not cause. And so congenital rubella was a really bad thing in the United States back in the days of very common transmission. Those in the audience who may have had a baby in the last 20 years, you would have gotten tested for rubella immunity when you were having a baby as part of your screening serology. But rubella is just a much, much more benign infection than measles. And it really declares itself almost immediately because of the degree of illness that you get.
Thank you. Let's see here. We have two somewhat similar questions online, so I'm going to put them together. Phyllis has asked, shouldn't there be a national informational media campaign by the medical profession? And then Maggie has asked, can public health and medical communities create an informational campaign to inform new parents of the safety and efficacy of vaccines? When we were in the hospital during all three of our children's births, we had to watch videos on SIDS, shaken baby syndrome, etc. Is there a plan to do something similar to show new parents how devastating these vaccine preventable illnesses can be?
So I'm going to avoid politics, which is really hard with this question. So those campaigns ideally will come from central sources in the United States. And we're going to have to shift that strategy somewhat to more local activity. Let's say it that way. We welcome all partners. One of the reasons I'm here is I'm in a division of 14 infectious disease physicians. We have sat together and said, it is time for us to up our game because we recognize times have changed. And the national guidance that's been out there and ad buys and PSAs may not be happening as frequently as we really think they need to. So we're going to have to jump in to sources like this. And I know I'm preaching to the choir, but if we all sing together, maybe you come out of here and you sing a little and that changes someone. So that's why I'm here.
That was very tactful. But you have also talked me into going, I had rubella 60 years ago.
Oh,
so it's like that. I'm a candidate for the vaccine. Then I'm taking from your dissertation tonight.
It's hard to find a vaccine. I'm not going to recommend tonight. Yeah.
Well, what about the threesome, the measles, mumps, and I mean that should I get that one?
Yeah, I mean that's the only place you can get measles vaccine.
Okay. Okay. Super.
So, but I always think of that as a double bonus because you're going to get two other vaccines with it. And you're going to boost your immunity to rubella. And rubella, there's very little rubella in the United States because that vaccine is so good. Mm-hmm. But there is some mumps. I mean, I don't know how many of you are hockey fans in here. You may remember Sidney Crosby giving an interview one night after a hockey season at shaking. I was watching a post-game interview with my wife, and my wife said, "What's going on with Sidney Crosby?" And I'm like, I think he has mumps. And we found out he had visited the hospital that day. That was great. That was really great. He visited the oncology ward. That was great. So, you know, mumps is, there's mumps in the United States. So you will benefit from that vaccine.
Thank you so much for your presentation tonight.
Sure.
What are the long-term effects of measles on children? Because
That's just a great question. Yeah, so, you know, we always knew measles was bad. There's research in the last 20 years that shows it's even worse than we thought. So this is some good research that came out in the last 20 years that shows that measles produces a pretty durable suppression of the immune system for not days or weeks or months, but years after the infection. So you are more susceptible to pneumonia, to ear infection, to other viral infection, much more than you were before the measles. So what we found out, it's even worse than we thought. And really, it's one of the things we think that helps explain the preponderance of severe infections in childhood when everybody was getting measles, because every kid was getting measles and then getting immune suppressed because of the measles. We don't know that it has major long-term effects, except for one thing. And the one thing is, it's got a very, very long and boring name. It's called SSPE, S for subacute sclerosing panencephalitis. But it is one of the most terrifying things you could hear about. Normal kids, somewhere between 10 to 20 years after their measles infection, start to regress in their neurologic status. They first begin to have movement disorders, then they begin to have speech disorders, and inexorably progress to death. Didn't happen very often, happened less than 1 in 1,000 measles cases, but it was a well-known and well-documented cause of late regression and death after measles. So thank you, because I didn't put that on the slide. It reminds me that measles is an infection with negative consequences that go far beyond just the infection itself. Those things can be seen for years. We thankfully don't see SSPE because we haven't seen that much measles in the United States. If we log 3,000 or 4,000 cases this year, which is possible, we'll see a couple cases of SSPE in the United States, and you just don't want to see that. It reminds me of a disease called Rett syndrome that we see in children sometimes. And all you need to know about Rett syndrome is the same syndrome that a neurologically normal child begins to regress and inevitably progresses towards death over a few years. They get your attention when those diseases happen.
Alrighty, still got so many questions here from our online audience. I love to see it. Let's see. One of our attendees online has asked, I was told that a cousin of theirs had died as a child from measles, quote, not coming out, but staying inward, I guess, in the bloodstream. Does that ever happen?
So I think, that line I showed you from, 950 AD was probably correct. You can get rapidly progressive forms of measles, particularly with encephalitis, that can kill very, very quickly, especially in big outbreak situations. So there are forms of measles, especially in the immune compromised, without quite as much rash, that can be very severe as well.
Thank you. That's honestly really quite fascinating.
Yeah.
In a terrible way. Can you please explain how herd immunity works? Somebody has asked.
Sure. Herd immunity, the most insidious vaccine refusal for me, just to frame this, is the person who says, I believe in vaccination, but I'm not going to expose my child to a vaccine because there's a risk of danger there. I'm going to let everybody else do it. And believe it or not, people will sit and give me that point of view. So herd immunity is a contract among all of us, because it is that picture that I showed you of measles with all of the infected people around that. If you turned a lot of them gray and immune, you limit the opportunities for measles to spread to the next person. So in this outbreak, Pittsburgh City has a vaccination rate that is around 93 to 94%. You could drop 50 people with measles in the city of Pittsburgh, and we would probably have 100 to 150 cases, and then it would snuff out, because we have a lot of vaccinated people. Herd immunity is simple. how many times can the virus turn and find someone who's susceptible? Because you need to have susceptible people next to each other, put that chain of transmission to keep endemic transmission going. So herd immunity simply means if you can get the herd, everybody around you, vaccinated up and immune, you're going to be able to bring down the level of disease. In the old days, there was lots of herd immunity to measles. We just had to kill thousands of children to get there every year because we were developing the immunity in the herd. Vaccines do that without killing anybody, which is why I'm pro-vaccine.
And it sounds so simple when you put it like that.
There you go. Feel free to quote me.
Okay, here's another one. Let's see. What Phyllis has asked, what do you think about RFK's new study, vaccines versus placebos?
So we've done these studies, and I think I try to give everybody the benefit of the doubt, but I'm a little flabbergasted when health officials say there aren't vaccines. They're actually required by the government. I mean, you can't do these studies. It's like the government requires them. You can't do these studies without a placebo. They're very rigorous about that. So if they want to repeat this and figure out that measles vaccine works again, that's fine. That's great. I'd love there to be like a betting pool where I could bet on the outcome because I know where I'm going to put my money. But I think the money could be used in a better place. And that's the same thing for the study of measles and MMR and autism, which is being proposed. We can use our money in a better place because we've done that over and over and over again. And actually, we are not going to be able to do it as well as some other countries have. We have whole country studies from Japan and Denmark and a number of other places with great public health systems that are able to take everybody in the country who's been vaccinated and unvaccinated and study them at the same time. So they're perfect cohort studies. So the Denmark study published in 2002 was like 500,000 kids. That would be impossible to do in the United States, given how expensive these studies are, but because they have a great public health system, they can just run their own data. I just don't see the point. Let's take that money and really look into what is causing autism rather than proving what we already know to be true. I mean, we could propose a study to prove that gravity exists. That'd be great. And we'd prove that gravity exists. I'm confident we would. But is it a good use of our money? So.
Thank you for that answer. It looks like we've got a question right over here.
Hello.
Hi.
You mentioned earlier that medical interventions can decrease the effectiveness of already vaccinated children.
Yes.
Is there any other data trends that are showing in kids that are not having these interventions and they are being susceptible to the disease post-vaccination?
Now, I mean, we know it's a very good question about the efficacy of the vaccine. So when we quote the efficacy, there's no vaccine that's 100% perfect. Probably the closest we have is tetanus. If you get tetanus and you don't react to tetanus, you should go to an immunologist immediately because it's like the vaccine that works. Measles is 97%, and 97% is really good, but that leaves 3% who don't react well to it and may have some level of susceptibility. Despite that, those children who often didn't make a lot of antibody did not get severe disease with measles when they get it. So they get modified measles. It's attenuated somewhat. There's a small number of them who got really severe disease, and that's how we figured out they had a severe immune defect. That actually MMR, you'll hear the anti-vax crowd say, MMR kills. Here's a kid who died from MMR, and they are actually correct. They're always talking about the case study of the child with Omenn syndrome, which is a really severe immune deficiency, who was unrecognized and got a dose of MMR and developed severe infection with it. But that's just luck that that kid got MMR as the thing that set it off. That could have been influenza or herpes simplex virus or anything else. So if you have no immune system, yeah, it's going to be bad. But even in kids who don't seem to react, they derive some protection. So it's a really, really good vaccine in that respect. It may not absolutely protect you from getting measles at all, although most of the time, 97% of the time it will. But even if it doesn't seem to work, it does seem to modify disease and keep you safe, which is just, I'm sorry to soapbox so much up here. Flu vaccine, you read this every year. Flu vaccine is only 25% effective this year. And you think, why did I get flu vaccine? So 25% effective means when we were studying it, it's 25% of people who got vaccinated never got flu at all when they were exposed to it. What we don't say enough is we have really good data that if you are exposed and you get infected, it keeps you out of the doctor's office. And if you go to the hospital, it keeps you out of the ICU. And if you're in the ICU, it keeps you from dying. So we don't talk nearly enough about modification of disease. But if I get influenza, I would really like to modify it in any way, shape, or form I can. So, measles does that too. At the high end, could there be a child who got measles vaccine who was healthy and derived no immunity whatsoever and was fully susceptible? There could be, but those children are going to be really rare. So it's a pretty dependable vaccine. And I got a shot in about flu vaccine too. I'm on a roll.
You got a shot in.
Ah!
Thanks for setting that one up.
I feel seen now. Thank you.
All right, let's pop another one out from our online audience here. One of our regulars asks, which preventable disease will be the next outbreak caused by unvaccinated people? So get out your crystal balls.
Well, measles is proving difficult because it is so contagious. I think you're going to see mumps much more frequently as well, and pertussis, which is whooping cough, more frequently. But we've already been seeing that a good bit. Those guys have been creeping back. You'll see mumps outbreaks in the news every now and then. What we're all worried about is avian influenza, because avian influenza is not that far from being able to evolve and move into human populations. There are lots of human infections, but they're limited and there's no transmission. Avian influenza would be the one that I think all of us are very concerned about, because it could move fast. And, COVID was really bad. Don't get me wrong. COVID was really bad. If you remember in 2020, the mortality rate from COVID was about 1%, 1 out of 100, which is a staggering amount. Avian influenza, most of us think it would be 5 to 10% in the initial wave before we got vaccines and other things going. So, we don't want avian influenza to come back.
So I told myself not to ask this question until you moved away from measles, but you do research on Lyme disease, and as one of those many people who've had Lyme disease.
Yep.
What's the prospectus for having vaccine or doing something for that so that we can be a little bit safer when we go out in the woods?
I promise that person is not a plant, but I do love to talk about Lyme disease. I came to Pittsburgh to do my medical school and then became a resident in 99. And then I started studying Lyme disease in 2002. And my boss at the time said, it's a really interesting disease, but we don't see it around here. Children's Hospital had 2 cases that year. This year, in 2025, we will break 2,000 cases. So this is another epidemic. It's just a quieter one. There was a vaccine in the late 90s. It was not great. There is a new Pfizer vaccine that we are studying now that is, I think, pretty good. It is going to require boosters every 5 years or so. I'm fine with that. There's a lot of misinformation around Lyme vaccine from the late 90s that's mostly not true. I would love to see that vaccine come in because we have a lot of kids get very, very sick, including once every 2 or 3 years, someone have a cardiac arrest from Lyme carditis. So it can be very severe in our community. And if you've had it, it can be, especially if it's detected a little bit on the later side, it can be disabling and really, really challenging for adults. So the Pfizer study, we are hoping to bring to Pittsburgh this coming summer. And we're working on that right now. We're going to advertise broadly if we have that opportunity. I got to talk about Lyme disease, yes.
Thank you so much for that information. Let's see here. Okay. Marianne asks, I'm assuming that families who are vaccine resistant are concerned about vaccines other than MMR or in addition to MMR. You've mentioned whooping cough pertussis, but what other vaccine preventable diseases might we see rising again?
So I think, yeah, we talked about this a little bit. I'd say beyond MMR, have become really tough conversations are COVID vaccines. There's so much politics attached to those vaccines that it's really sad for me. They saved hundreds of thousands of lives in the United States. And we have pretty incontrovertible data about that. And, you know, I hear a lot of when I talk to them, COVID never was a problem for children. 3,000 children in the United States died of COVID. I don't know why that fact has not been widely known. 3,000 children, a bad flu season in the United States in kids kills about 150 to 200 children. And we lost 3,000 kids in 2 years to COVID. Very, very challenging for me that people downplayed that and dismissed it. But those conversations have become much, much harder. And I get a lot of, I don't want to talk about this, which makes my job very hard to connect with families. So yeah, that's become a really challenging part of my job.
Certainly does sound quite challenging.
Yeah.
All right. Well, let's see. We've still got a couple more coming in online here. Dawn has asked if you had measles in the 1940s and 50s, should you get a shot now or are you still covered? I'm going to guess that Dawn never had a vaccine.
So if you had wild type measles, it's really good. As long as you don't have immune compromising conditions. You know, we even in resource poor settings where there's a lot of measles around, the elderly in those resource poor settings don't get measles. So we have a little natural laboratory there. There's something about the immunity to measles that's, you know, better than some of the, like, you know, pneumonias that we see in older folks.
Thank you. Okay, another one here. You have focused on measles in the US. Can you discuss worldwide measles trends and any implications towards international travel?
Yeah, so worldwide measles trends are not so great. And we have seen a little bit of rebound of measles since 2022 around the world. You know, we went from 600,000 deaths, not cases, deaths worldwide from measles in 2000 to around 135,000 in 2022. Those are almost all kids. So the math there is simple. That's 400,000 plus children who were dying each year who didn't die because of measles vaccination. But we are seeing a lot of measles outbreaks. So when you think about travel-related cases are happening. They were the first 2 related cases in Pennsylvania. I'm going to give you a really easy website, travel.gov. Travel.gov, I go to almost all the time because travel.gov will tell you which diseases tend to be endemic in the place you're going. And if there's measles going on there, then that's a really good reason for you to make sure you've gotten everything up to date. And in particular, it's the one situation where if there's a baby traveling with you, that we will give that baby a vaccine at 6 months and not a year to give them extra possibilities for protection. Travel.gov. Now I'm going to say something nice about the government. Travel.gov is an amazing resource. I consult it almost every day as part of my work, and they really have very accurate information about disease outbreaks.
Thank you. To follow up with that and on the topic specifically of government-sponsored websites, you know, you understandably referenced the CDC's website a bunch. Recently, the information available on the CDC's websites has shifted. Some of it has gone away. Some of it has changed. Can you speak to the reliability of that particular website right now?
So I will say the data that I reported to you, I think is solid. I worry a little bit about some of the states reporting data underreporting. The removal of website information around sexually transmitted infections, LGBT health, gun violence, and intimate partner violence is really troubling to me as a healthcare practitioner. I hope that a lot of those decisions get reconsidered because it's not good for our community. Accurate health information helps me do my job. And accurate health information helps you to make healthy choices about travel, about infections that you may have heard of. I mean, it's good for everybody. It's very troubling to me that a lot of that has been replaced. CDC has not changed any of its vaccine hesitancy information, which I'm hopeful will stay that way. But we'll see. We live in interesting times.
Thank you. Okay, we've got a double whammy here from Phyllis.
Kudos to the online audience.
Yeah, the
Very
online
inquisitive.
audience is on
Wow.
it tonight, folks. You're being shown up. So
No, this is not a taunt.
it's not. I mean, it might be a little bit. Okay, so first Phyllis asked, and I'm sure this came out when you were speaking about some of the things that you and your peers have been discussing. They asked, are you confident that funding will be enough for UPMC to continue their research? And then I think, Phyllis, it's really interesting that you asked, I just tried travel.gov and said the site cannot be reached because I literally did the same thing.
Oh no.
And had the same result. Now, it's possible that there is a storm going on. I don't know what that's about, but
if they took down travel.gov, I'll be really mad. So will UPMC, the University of Pittsburgh's funding be affected? I will only say what I say to people because this is not politics for me. I am a proud child of Western Pennsylvania. I grew up in Greensburg in the 1970s. And so I got to see the steel industry fall. And I saw the effect of the steel industry. A lot of folks in this audience who were probably here at the same time, and you remember too. That was not fun to watch as a community. The steel industry of 2025 in the Pittsburgh area is science and technology. That is our steel industry. And the obliteration of scientific research in our community will have the same effect that we got to live through in the 1970s, which destroyed some of our communities and was really negative for the Pittsburgh area. So when I speak to my legislators, which I do frequently, I actually will say to them, I don't find this to be an issue about science. I find it to be an issue about jobs. The science and the discovery part just saved lives and is wonderful. And for every $1 invested in these grants, we tend to reap 2 to 3 in terms of the benefits of it. But it's about jobs for Pittsburgh. So, we're all able to contact our duly elected representatives and provide your input. I encourage you to do that. This is not about whether you like the science. I think a lot of it is about whether you want jobs to be in Pittsburgh. We're watching a lot of colleagues lose jobs, and that is very challenging for me.
thank you. And it looks like another attendee online found that travel.state.gov works just fine. And so maybe that was the issue that Phyllis and I were both having.
But that's probably the federal government just messing with me specifically. So yeah,
probably.
yeah. It's still there.
All right.
I literally never travel without going to that website. It is gangbusters, and it is absolutely wonderfully written layperson language. It's easily understandable even to me. So it's good.
Thank you. That it sounds like a really wonderful
Yeah.
resource. Let's see here. So okay, Kitty Mama asks, here's another $1 million question. Why are anti-vaxxers so influential? Why did the general public accept their claims so readily?
Well, they're well funded. They're well funded, and we were taking the high road and they were taking the low road for a long time. And we were relying on science, which, the best science that you do, as I was saying to Sarah before, that you can't communicate to someone is no science. And I think we did not have a good game in terms of our communication. We need to get a lot better at that. And we need to tell really big stories the way that they tell big stories. And we need to talk about the fact that these are diseases that kill children. and they're really serious diseases. So, I mean, I feel like we're a little behind in this race, but we can catch up. We just need to be aggressive and unified about it. They've really weaponized the new media, and then they've been able to connect it to political causes at times that have really benefited them. So, we have a lot of work to do. That's okay. It's good work. I like doing it.
Thank you. That's a really encouraging response to, I think, what can be a frustrating issue. Okay, got another one here. So Ramona says, this question may be off topic. Is participation in misinformation by a physician a form of malpractice? And if yes, can the State Board of Medical Practice restrict the license of physicians or, who would engage in that?
So some states have taken a more active view of that. And it's very variable state board to state board. I think where we have, as a community, we are focusing more on folks whose pattern of practice is just really, frankly, way out there. And state boards have been very receptive to that. I think you're always allowed to, if you see major misinformation, to make a complaint to the state board. They investigate things very, very thoroughly. So you always have that option as a person in the public. That's why there are state boards of medicine, to give you the opportunity to say, I'm suspicious of the information being put out there.
All right, thank you so much. So let's see here. I've got one more question from online, and I think that's going to be our last question of the evening.
Now you got a thumbs up, so we're good.
So, okay. Actually, JK, this question is from me personally. I have a good friend who, even as an adult, has a bunch of like food related allergies, as well as like a latex allergy. She told me recently that she had only one dose of MMR as a kid. She had a terrible reaction. The doctor was afraid to get her the second one. Her mother was afraid to get her the second one. They don't really know specifically why she reacted that way. She says it could have been eggs because she had an egg allergy as a child. And I believe that those were in some vaccines. Now, I recently learned this and started saying, oh my God, you have to find out if you can get the MMR vaccine now. So I would love to ask you, for folks who may have experienced that, especially with that gap of 20 or 30 years and what may have changed in a vaccine, what do you recommend?
So no eggs in the current MMR, number one. And number two, this is a great opportunity to go to your allergist and just ask. The vast majority of people who've had a severe reaction, it doesn't mean that you can't have another dose of vaccine. We try to be safe with vaccines. There are definitely reactions you could have to a vaccine, anaphylactic reactions, that we would not give you another dose of that vaccine. We are interested in safety with vaccines. We test them for safety more than almost all other medications out there. But I get a lot of consults like this where we're asked to sift through the records, and I really ask about what the reaction looked like exactly. And then we get a sense of how risky would it be to give another dose of the vaccine. Most of the time, especially current data shows it's very, very safe to give another dose of the vaccine as long as it's been evaluated appropriately.
Okay, so if somebody had a reaction like that and for whatever set of reasons was not able to get reliable information on exactly what the reaction is, it sounds like you had said that they could consult an allergist perhaps for more insight.
Yeah, an allergist or sometimes an adult infectious disease doctor. Yeah.
Great, thank you so much. All right. Oh, it looks like we've got one last one down here. Drew, you want to go ahead? Bring that mic over.
We're talking infectious disease. What about tuberculosis? Because I hear that is just being all over the world.
Yes, so tuberculosis is, to give you this global burden of TB is like 1 billion people. It's a staggeringly common infection. There is a lot of billion with a B. Yeah, I mean, it's really unbelievably common around the world. We are seeing increasing amounts of drug resistance. But the US is a really good place to live with respect to tuberculosis. One of the things that public health has done in our country is to almost completely eliminate it as an endemic disease. So it's very hard to get it. The Pittsburgh area is absolutely tremendous in terms of not having TB. We just don't have any TB in Pittsburgh. People come to Pittsburgh with TB from somewhere else, but we don't see any transmission around here. So you should be very, very safe if you're worried about tuberculosis. I can't speak for Cleveland. Who knows what goes on up there? But Pittsburgh, we are really good. So.
All right. So I'm gonna hop back up here. Folks, let's give Dr. Nowalk a really big round of applause.
Thank you. Thank you. Thank you for the wonderful questions, and thank you for being engaged on this topic, because I'll be open and honest. I need you to be our partners in this work, because we got some work to do. Yeah.
Thank you. I personally also just found this deeply engaging, especially as parent of a young child. Thank you to our wonderful on-site audience. Thank you to our incredible online audience, killing it with the questions tonight.
Oh my God.
And I hope to see all of you back here next month for Cafe Sci. Please check under your seat for your garbage before you leave. Have a good night.